listener production.
Hi, Natarsha Belling with you and welcome to the afternoon edition of The Briefing. Coming up in our deep dive, infectious diseases experts are raising the alarm over a concerning increase in antibiotic resistance to a number of serious diseases and infections. Rates have jumped by more than 40% in just 7 years. But the overprescription of antibiotics is only a small part of this major problem. We'll find out more in just a moment. But first, let's check the afternoon headlines this Thursday, the 30th of October. President Donald Trump has ordered the US Department of War to resume testing of nuclear weapons. The shock announcement came just hours before the US leader met with Chinese President Xi Jinping in South Korea. President Trump admitting it would be a tough meeting with the Chinese leader.
But he's a very tough negotiator. That's not good.
The two leaders are holding talks aimed at easing trade tensions with a potential deal expected later this week. President Trump took to social media before the meeting and said, quote, "Because of other countries' testing programs, I have instructed the Department of War to start testing out nuclear weapons on an equal basis," adding the process will begin immediately. The US last tested a nuclear weapon in 1992. The family of a teenage cricketer killed in a tragic training accident has issued a heartbreaking statement saying they are all utterly devastated. 17-year-old Ben Austin died after being hit by a ball in the neck while training in cricket nets in Melbourne's East. He was wearing a helmet at the time, but passed away after suffering critical injuries. In a statement, Ben's dad, Jace, says Ben, quote, "was a shining light in the lives of he and his wife and his brothers, Cooper and Zach." Adding, "This tragedy has taken Ben from us, but we find some comfort that he was doing something he did for so many summers, going down to the nets with mates to play cricket." Lee Thompson from Ben's local cricket club paying tribute to the much-loved teenager.
We're absolutely devastated by the passing of Ben, and the impacts of his death will be felt by all in our community, Infantry Gully District Cricket Association.
Cricket Victoria says the accident was similar to the one that claimed the life of Philip Hughes a decade ago. And Nationals MP Barnaby Joyce is denying allegations that he verbally abused a female staffer. The alleged incident is said to have taken place yesterday after Mr Joyce was allegedly told he would need to fill out a form to request leave from Parliament to attend a funeral. The ABC is reporting that the matter has been referred to the Parliamentary Workplace Support Service. Mr Joyce, who was absent from Parliament today, has denied the allegations and says he, quote, "respects the Parliamentary Workplace Support Service process." Now it's time to get into our deep dive on the concerning increase in antibiotic resistance. The World Health Organisation's latest report shows it's estimated that now 1 in 6 common bacterial infections is now resistant to antibiotics, leading to millions of deaths around the world. Joining us is infectious diseases expert Sanjaya Senanayake, who explains the complex reasons behind this serious trend and why we need better diagnostic and surveillance systems. Doctor, thanks so much for joining us. Can you explain to us, firstly, what is antibiotic resistance and why should we care about it?
So, not even 100 years ago, in 1928, Alexander Fleming accidentally stumbled upon penicillin, and that's when our interaction with antibiotics started. So it's really been less than 100 years. And if you think about it, bacteria have been around for a very long time. And even Homo sapiens, us as a species, we've been around for a good 250,000 years. But in less than 100 years, we've gone from antibiotics being able to be used effectively all the time to kill bacteria to becoming resistant, with the bacteria becoming resistant. So it's getting much harder to kill them. And there have been situations where people haven't been able to be treated with antibiotics.
How serious is that?
It's very serious. I think it's almost something we take for granted. Like in Australia, I think the concept of starvation for most people is beyond our comprehension. There's always something to eat. And I think it's like that with antibiotics. You grow up thinking, if I'm sick, if I've got an infection, I can have an antibiotic. But for it to happen so quickly where we're now thinking twice about whether antibiotics will work against a certain infection where it used to. That's pretty scary. And as someone who treats patients, I do get nervous sometimes.
And it's quite a complex or complicated situation. It's not just one answer as to why we're seeing this increase. Not only is there antibiotic resistance, but it's actually increasing at concerning levels. Can you explain why?
Yeah, that's right. And this recent World Health Organization report showed that in the sort of last 5 years, or when that report was done, there'd been a more than 40% increase in resistant infections, and 1 in 6 infections that they looked at were resistant. And to put that at a global level, either directly or indirectly, we're seeing about 5 million deaths per year due to antimicrobial resistance. That's about 1 in 9 deaths that can be attributed directly or indirectly to antibiotics. And so it's not just a simple fact of, Dr. Sanjay, you're prescribing too much antibiotics, you stop that and we've solved the problem. It's not that at all. And in fact, it's a problem that if you were sitting with the Prime Minister in cabinet, it wouldn't just be health, it would be trade, it would be agriculture, it would be environment, it would be a whole lot of portfolios that are involved. For example, most people won't realize that over 70% of antibiotics used in the world are not used in humans. They're used in animals. And because of that, and you think, well, that even then, that shouldn't matter. But the reality is we interact with animals at the agricultural level, the farming level. We touch them, we farm them, we eat animal produce. So that allows bacteria that become resistant after exposure in animals to get into us. And in terms of the biggest users of antibiotics in agriculture, there's China, India, the US, Brazil, and Australia. I think the 5 of us account for about 58% of that. Then there's just environmental aspects. There's antibiotics in wastewater in various parts of the world. A study in India recently looked at 4 big cities and found large numbers of antibiotic-resistant bacteria. And the reason that happens is there's bacteria in wastewater, we know that, but there's also antibiotics in wastewater. So 70% of the antibiotics used medicinally end up in the environment, either through us getting rid of it through the usual way, or through factories and other industrial waste. And of course, when the antibiotics meet bacteria, the bacteria can become resistant. And if they're in wastewater and you've got poor sanitation, that can lead to people getting antibiotic-resistant bacteria in themselves.
Doctor, you mentioned earlier this World Health Organization report that's just been released. It also found, to your point there, that the highest increase in infections resistance with antibiotics is in Southeast Asia and Eastern Mediterranean regions. Why is that, for exactly what you've explained regarding environment issues?
I mean, that's part of it. So we've talked about it being such a multifactorial issue, and you need a couple of things. One thing you need is to be well-resourced. And a lot of the developing countries have really done well. They've come on board since this was recognized at the UN World Assembly as an international issue at a political level. A lot of countries have come on board in terms of providing data for the World Health Organization, so international data, so we can see where all the resistance is coming from and what the trends are. We went from a few years ago only having about 749 sites reporting this to almost 25,000, which is wonderful. But the quality of the surveillance from those poorer countries isn't that great, even though they are contributing. And that's important because if you can't keep an eye on what's happening, then that's an opportunity for resistance to increase. So that's one problem. And of course, in hospital systems as well, in Australia, we've got very strict antibiotic stewardship programs where we have the technology and the capacity to look at how antibiotics are being used in hospital and try and do that in a better way. It's much harder in developing nations. So that's part of it. And I was involved in a paper about 10 years ago, And the paper came about when we collaborated with an economist because we were thinking, look, we see all this antibiotic resistance in the Mediterranean, Southern Europe, and in Asia. So surely it's got something to do with countries being poor, maybe a low GDP. And so we collaborated with an economist at the ANU. And the paper that came out was really surprising. What it showed that the strongest association with antibiotic resistance wasn't GDP, but poor governance. And this was in the EU, by the way, not Asia. It was in EU. And poor governance means corruption. And this paper caused a bit of controversy. The people of the EU were saying, shaking their head, we're not corrupt, But it does make sense because if you have to, talking about all those portfolios in cabinet, the environment, looking after health, trade, agriculture, if you've got poor governance, then those are going to fall in terms of best practice. So they're the sorts of issues that the developing world has to deal with.
Sanjaya, it seems like this is certainly a ticking time bomb where all of us really need to care about this concerning trend. If I can ask you possibly an incredibly difficult question, but what are the solutions? What do we need to do, both here in Australia but also overseas, to ensure that this trend does not continue?
Look, there are a whole lot of things that we can do. So ensuring universal access to good sanitation and healthy water, good hygiene, we estimate that will reduce antimicrobial resistant related deaths by about 300,000 to 400,000 people a year. So that's something that can be done at the governmental level. At an individual level, there's always the education that we tell people in the community. If you have a fever, or more importantly or relevantly, if your child has a fever, it may just be a virus, so don't necessarily seek antibiotics. And we also have to do that at the other side as well, where we're teaching general practitioners and doctors in hospital not to prescribe antibiotics when something may be viral. And if you are going to use antibiotics, use something that's narrow spectrum, not really broad and powerful, because exposure of other bacteria in your body to something broad and powerful can lead to resistance. We've talked about better all the antibiotic use in agriculture. So we've recognized that we need a One Health approach to antibiotic use, which involves human health people and animal health people working together. So that's really important. And also better vaccines, so people don't get infections in the first place, so they don't need antibiotics. Better diagnostics, so we can quickly work out what kind of infection someone has, so we can give them the narrowest antibiotic as soon as possible. And of course, also new antibiotics or new substances which can act like antibiotics as well. And that's a whole nother issue, because antibiotic production is not in the economic interests of drug companies. It takes about 10 to 15 years to develop an antibiotic for a drug company. And by the time they do so, they're at an economic loss. And then if they've made this wonderful new antibiotic, and they want it to be used everywhere, I, as an infectious diseases physician, say, oh, look, this is such a wonderful antibiotic, but because it's so good, I'm not going to use it, only if I need to. So from an economic business point of view, it's not good. So we talk about push and pull incentives to try and get drug companies to make more antibiotics, pushing them in terms of, at the developmental stage, reducing regulatory barriers, etc. And the pull, meaning there's an act called the Pasteur Act in the US they're trying to get through, and there's another law in the UK where they're trying to incentivize drug companies to make antibiotics by saying, hey, it doesn't matter if no one buys this amazing antibiotic, we're going to pay you anyway.
It's important we keep the spotlight on it. Really appreciate you joining us to unpack all the implications for all of us. Thanks so much, Sanjaya.
Oh, thank you for the opportunity.
That was Sanjaya Senanayake. And that's it for this episode of the afternoon edition of The Briefing. We'd love you to subscribe or follow us on Instagram at The Briefing Podcast. I'm Natarsha Belling. Thanks for your company.